Welcome, Neurofeedback Experts, to our webinar today on ADHD myths and facts. Learn the truth to get the help you need. Now, it is entitled that because this webinar is for neurofeedback experts, but this is to prepare you to get ready to communicate with your clients or patients or prospective clients in October for ADHD Awareness Month. So this is a national initiative from the ADHD.org website, and they have a theme every year. Last year it was Know the Difference. This year it's Myths and Facts. So what I've put together for you are the 3 top myths surrounding ADHD and the 3 number 1 facts surrounding ADHD to demystify those myths. So let's dig in. Welcome. Of course, I'm Dr. Trish Leigh. As you know, I'll be your hostess with the mostest. But just to remind you that why are we constantly talking about ADHD when we think about providing neurofeedback to our communities, to our country? And this is an image that you've probably seen me share with you before, is because ADHD numbers are going through the roof. And this is an infographic that shows how many medication treatments are being delivered to children across our country. And I live in a state that's dark red, which is one of the highest levels. And you'll see that down the eastern seaboard and in some of the mid states, medication levels are through the roof. And in a study I'm going to share with you at the end of this webinar, I'm going to give you the author, and of course in our Neurofeedback Expert monthly niche workshops, this article will be there for you. Hopefully you'll just spend a few minutes browsing it because it has so much more information than I'm going to provide for you here today. But my point was going to be that there's new studies, they're not that new, but they're not old. There's newish current studies that show that neurofeedback is equally as powerful in reducing symptoms of ADHD as medications. Now digest that for a minute because it's all I'm going to say about medications here today. Neurofeedback has been scientifically proven to be equally as powerful at decreasing ADHD symptoms. Now that sounds great to tell a prospective client or patient, and it is great. But what's even greater that I make sure that people who work with me know is that medications are proven not to change the underlying brain pattern of a person with ADHD at all. It's just a Band-Aid. So I often refer to medications as a Band-Aid because you consume the medication and for a time it artificially regulates the brain so that it has less symptoms, but it actually doesn't change the underlying pathology. Neurofeedback does. So medication is a Band-Aid, it's a quick fix, and we know there's lots of harmful side effects. Scientifically proven, the number 3 top side effects of medication are sleep problems, an increase in anxiety, and weight loss because kids don't eat, loss of appetite. And actually malnutrition or nutrition, not even weight loss is an issue, it's nutrition. So those terrible side effects come along with the medication where there are no side effects with neurofeedback. I don't need to tell you that. I know you know that, but what I want to communicate to you is an easy and effective way to communicate that to your clients and patients, is that new studies show neurofeedback is equally as powerful as medication without the terrible side effects, and it changes the underlying brain pattern forever in the positive direction. So if you want more information on that, go to my YouTube channel. There's short videos on changing a negative feedback loop to a positive feedback loop. Would be a great video for you to watch because it explains how we use neuroplasticity to create that change. But in the short run, we're going to keep going. ADHD myth number 1. The number 1 myth that people have surrounding ADHD is that it is a fast brain pattern. So they think that the brain is running fast, and that's why a person has hyperactive behaviors. They think the brain's going so fast that it can't focus, and that makes a person squirrely, so they have social issues, and that it creates stress. What is true about this is that the stress and anxiety piece is true, but it's not from an ADHD pattern. It's from the exact opposite pattern that I will show to you in just a minute. But this is a myth, and you need to dispel this myth, and ADHD Awareness Month is the perfect time to do it, because as you hopefully already know, ADHD fact number 1 is that ADHD is a slow brain. It is a brain that is running much too slow. It's an increase in theta. Many times delta is also increased at the same time. It can be a decrease in beta power as well. So we'll look at a study again in a few minutes that looks at the theta to beta ratio. So scientifically, it's been shown that theta is 3 times higher than beta. And that's what would qualify as a diagnosis of ADHD. And our technology, QEEG brain mapping, is being used to confirm diagnoses, and it's FDA regulated to confirm diagnoses right now. And actually the scientific studies show that it's better at confirming the diagnosis of ADHD than old school behavioral ways. But we'll probably save that for another webinar. Okay, so what's happening in the brain of a person with ADHD is there's too much sleep mode. So we know delta and theta are sleep mode. So this necessitates offsetting to be able to stay engaged. Physical offsetting of the slowing or the falling asleep of the brain is physical hyperactivity. Mental offsetting is anxiety, spinning the wheels, constantly thinking, rumination, use of extra fast brain speed to offset all that slow brain speed. And we're going to look more at this in just a second. So let's talk about this in terms of arousal. And this is really important for you to understand and to be able to communicate to your patients. And I really love this diagram. I borrowed it, but I really like it. What we are hoping to achieve for our clients is regulated arousal. And you can see that nice wave across the middle is regulated arousal. That happens when a person's brain map looks optimal, which I always think of as a unicorn, but we're trying to get them as close to that optimal pattern as possible. When we see very jagged arousal, up and down and spiky, which we often see in our neurofeedback trend graphs, that indicates a dysregulated brain pattern and dysregulated arousal. So these bubbles are good to show you what that means. Optimal arousal means that you can be present, you can be embodied, you can be open, curious, you can tolerate feelings, you can be relaxed yet completely alert, and you're able to think and you're able to be relational. Sounds great, doesn't it? That's why we are here, because neurological regulation creates the optimal arousal zone, which creates self-regulation, which we'll look at in a second. Sympathetic hyperarousal. So hyperarousal, which is much too much use of high beta, hyperarousal, and right now we're looking at it opposed to hypoarousal. Hyperarousal is anxiousness, panic, restlessness. It can create hyperactive symptoms. So this is too much high beta. And what I'm trying to tell you, and I've told you before in other webinars, is scientifically, you know how I love the science, scientifically, the ADHD slow pattern has been shown to be comorbid with this hyperarousal pattern of anxiety, which can create even more hyperactive behaviors. Or if a person has ADHD and they have hypoarousal from it, we can have comorbid hyperactivity from too much hyperarousal, which gets to be difficult for the person. But if we can bring their brain back down from these two extremes of hyperarousal and hypoarousal into the middle of optimal arousal, we can alleviate those issues altogether. Emotional flooding, impulsivity, risk-taking, poor judgment. Down in hypoarousal, which is what we're currently actually talking about, flat affect, depression can sometimes be present, lethargy, numbness, disconnectedness, dissociation, despair, self-loathing, hopelessness, full of shame, victim identity. These actually portray more of alpha hypoarousal, but along with that can be fatigue from delta hypoarousal. It can come with lack of focus, lack of concentration, difficulty with productivity because of too much theta hypoarousal. So when we have these two working together, it makes it so that optimal arousal cannot happen for people. Okay, so let's look at one more thing, and because I also wanted to show you this is how arousal impacts our behavior. And we've already went through some of it, but you can't think clearly when you're hyper aroused. Intrusive imagery, so PTSD's up here, reactivity, reacting instead of responding, increased sensation, and we've already talked about the rest. Down in hypoarousal, difficulty tracking conversations, which is a very major thing that many people with ADHD report. Lower heart rate, relative absence of awareness, disengagement, can't take in and process things clearly because of slower processing speeds, reduced physical movement. So just to show you, when we have hypoarousal, it's a brain that's running too slow. That is what ADHD is, but it's comorbid with hyperarousal. So what does it look like on our brain maps? Just to remind you, and no matter what system you use, I want you to get used to converting in, and I do have a couple different systems here that I'm going to show you throughout this presentation. Everybody's using different systems that are part of our neurofeedback family right now. So I have the raw EEG data, and you can see that we have slowing, like up here at FP1, FP2, F3, F4, we have slowing happening. We know that's happening by the loosening of the waves, which means that the brain is no longer using beta, it's moving into theta. That's what those loosening waves look like. And what we see on our brain map is that theta has 3 standard deviations too high of use, while it also has 1 to 2 standard deviations too low of use. Now, here's something I want to be able to just re-communicate to you professionals that I will not mention on the webinar for patients. I want you to remember what standard deviations actually show. And actually, I don't have the bell curve. I'm thinking if I have the bell curve, I don't think I might have the bell curve coming up. And if I do, I will talk about it then also. But if it's not in here, I can't remember, I put a lot of slides. If it's not in here, look at the bell curve again and see that the bell curve shows you that the majority of the population is included in that bell part of the curve. When we get out to the extremes, which red is an extreme in the bell curve, it means that it's 0.001% of the population. So if someone's theta is all red, it means 99% of the database for that person's age has better brain performance than they do. So it's not just 3 levels too high, which is the simplified way that we talk about it, but you need to create urgency around it, because it basically means that the majority of the population's brain performance pattern is better than that person's. And especially when it's global across the brain, that is urgent. This theta really needs to be decreased so that hypoarousal can come down. The brain can be in the optimally aroused state for all the reasons we just looked at on the last 2 slides. So that is your job, to be able to communicate to people, is that this is urgent. 3 levels too high means your brain has a lot of work to get into the optimal zone. Okay, so hopefully we're cool on the standard deviations, and if we get there, I'll reiterate it again. Okay, so we already said that the anxiety brain pattern is comorbid to the ADHD brain pattern. So many times, most times I would say in my own experience, and I'm pretty sure the science backs that up, when someone comes in and they have a true ADHD brain map, it will have what I just showed you. Too high of theta, not enough beta. But most people have too much theta coupled with too much high beta, as we see on this slide. And you can see in the raw data, that's very, very tight waves, excessive high beta, very fast energy, giving all of the hyper aroused behaviors and state complications that we just saw on the last couple slides. So expect to see anxiety with ADHD, and know most times you'll have to train the 2 of them at the same time. And everybody's system has the ability to do that, I think, off the top of my head. I know everybody I'm working with here right now, your systems have the ability to do that. So that is probably a necessary component to training theta down, training high beta down, and training SMR or low beta up. That's what the study shows that I'm going to show you on the last slide, or one of the last slides. Okay, moving on. Sake of time, you know how that goes. ADHD myth number 2. If the person tries hard enough, they can focus and be more productive. Now, these myths are not for you. These myths are for you to communicate to your community. So many people who come into our office think that it's just the kiddos not trying hard enough, or when there's an ADHD spouse, that the spouse is just a loser and doesn't want to get motivated enough to get a productive job. Then when you do that person's brain map and you see that delta and theta are off the charts, they're 3 levels too high, and especially if they're very slothy, they probably don't have that excessive high beta component to it. But if you see that this person is seriously hypo-aroused, they can't get off the couch. Their brain is making it so that they can't. And that is the fact. And we're going to look at that in a second. But another main component that I wanted you to remember is that hypoarousal will affect a person differently depending upon which areas of the brain are impacted. So the frontal lobe is going to be socialization, executive function, impulse control, and judgment. I'm going to show you in just a second. Temporal lobes, strong emotional regulation areas. We see a lot of sensory processing issues happening here too. And then, of course, the learning pathways, which are encompassing all of verbal comprehension, being able to put together expressive language, being able to do that verbally, going across the sensory motor cortex, being able to put it in writing, being able to regulate it emotionally. So let's look at the 10-20 system and think about that. So we can see, here's my cursor, we have attention, executive function, impulse control, and judgment across these frontal lobes. What I was talking about, and socialization is proven to be all in the frontal lobe. P3 is where we have verbal comprehension going up to C3, including F3 for verbal expression, motor planning over here, F7, going across the sensory motor cortex to be able to integrate and be able to use the hands and extremities for writing, being able to have emotional understanding, to be able to write appropriate content, all of it. So for the learning pathways, they go up and over. So depending upon which areas are impacted, and you're looking for that on the QEEG brain map, the areas impacted will many times dictate the symptoms or the ways that the hypoarousal affects the person. So keep that in mind, and that's what you're looking for on the brain map. But the fact is, hypoarousal makes it almost impossible for the person to focus, engage, be motivated, be productive. And the analogy I always tell parents, especially when they come into the office, is that, if you tell your child to focus harder when they're focusing their hardest, and actually, not to beat science to death, but you know how I am, the science shows that for many kids, especially like when it comes to test anxiety or performing homework, the harder a child with ADHD tries to focus, the worse focus gets. And that means delta and theta increase because of fatigue and overwhelm. So it's like telling a person to run faster who is trying their hardest to run the fastest that they can. That is not a strategy. The strategy is to decrease hypoarousal, get perfect arousal happening for that person so they can function better and accomplish their goals and their dreams. That's why I am here, to help you, which is why you are here. So thinking about what neurological regulation versus neurological dysregulation syndrome, as it's called, plays out for people in terms of self-regulation. And I've already told you much of this, but self-regulation is very difficult for a person in hypoarousal. Willpower, executive function, effortful control, emotional regulation, self-control, and self-management all tank when the brain is not in the optimal arousal pattern. So remember, that's breaking of the brain. The brain's got the brakes on when it's using too much theta. And there's really nothing else out there that can regulate the brain pattern of a person with ADHD. That is true. Supplements will help a little. Functional neurology will help a little. If you want to help a patient a lot, neurofeedback is the way to do it. It shifts the brain out of the gears, gets it back into circadian rhythms, that appropriate arousal pattern. Okay, moving on. Let me check my time real quick. We're great. We're doing great. Moving on to ADHD myth number 3. people must live with ADHD and that they can only compensate for their difficulties and their challenges. Not true. That was true a long time ago. That is not true now. The fact is ADHD can be healed. And I want you to hear that word. I don't know if you're able to hear that word or not. Some people are and some people aren't. Some people don't like that I use that word, but you'll see the brain that heals itself, right? Norman Deutsch has a book out there that is titled that. Our brains and our bodies are self-healing. They can heal themselves if they are pushed in the proper direction. Our job is to help push that client's or patient's brain in the proper direction to break the negative feedback loop and establish the positive one. So it can be, hypoarousal can literally be decreased in the brain, and the brain can be taught to no longer make the hypoarousal pattern, but instead make the optimal arousal pattern. It's proven scientifically, and as cheesy as it sounds, I like to say that it has a 65-year legacy of success because it's totally true. And there's lots of great science out now showing that it is very, very, very effective. And the beef has always been that there's not enough randomized controlled trials. And I know I sound I sound snotty in my tone there. And I am a scientist. I love me some science, but sometimes randomized controlled trials are not what shows that something works. So there's lots of them now, thank God, so that those who need that aspect of research are getting it. But the research has been around for a long time showing that it works. Okay, so this is just an example of neurofeedback. I'm not going to explain it to you, but when I do my webinar in October, and I'm always happy to have other offices jump on that webinar, and I'm looking to see what the date is. The date is October 22nd. It's a Tuesday, October 22nd is the day of that webinar, and we will be showing people how neurofeedback works. And there's our bell curve. I knew it was in here. And talking about regulating the brain into the green zone. So if green on the map bothers you, I'm sorry about that. And I will tell you honestly, my maps are gray when it's optimal. People don't even notice. They just like the idea. People can wrap their minds around that they're trying to take their brain from red to green. And if you're in the Neurofeedback Expert program, which all of you are, then you know that being able to communicate with people in a way that they can wrap their mind around this really difficult neurological stuff is very important. So people really like the idea of the green zone, which is why I use it. And you can see there in the bell is green, and that's where the majority of the population, and as close you get to the peak of the bell, that's optimal brain performance. And like I already told you about, when you get out into these extremes way out here, that's hardly anybody, which means all these people have better brain performance than a person who has an all red brain. It's important to communicate that to a person. Okay, here's another format. So if you're using a ClearMind system or a brain core system, it's still the green zone. So the green should feel okay to you. And here we go. We have a green zone and theta and alpha. And this is just an example of green. Blue are the areas are running too low in a speed. Red are the areas are running too high. And this map actually doesn't have yellow, but yellow is very high. But you can use the same concepts. Okay, here's an example of an ADHD neurofeedback training session. And you can see here how the patient starts with delta and theta. And delta is the main culprit for this kiddo. Starts really high and comes down. We see these chaotic spikes, but we see it also plateauing here for about 15 minutes in the middle. And then we have these big spikes that indicate fatigue of delta. This is a kid who had really bad ADHD though. And you can see and that's delta, theta spiking and going along with delta, and high beta is yellow. It's a little bit elevated, indicating some comorbid anxiety. So what we want to be able to look for on your trend graphs, and yours might look a little different, but it's all the same information. You want to look at how high delta and theta are starting. And I always think about it. I won't throw out any numbers or anything here right now, but think of the gap between delta and theta and alpha, and then low beta and high beta. We want them to be stacked in this proper order. Delta, theta, alpha. We want it to be low beta and then high beta at the bottom. But this gap between theta and alpha is a really big one to start off with. That's what creates ADHD. And so when we close the gap down here, the closer we can get this gap together, and if we can get the green over the yellow, will affect change in this person's behaviors and their symptoms. Okay, the scientific study, the one that you'll have in the course, is by Arns et al., 2013. It references so many other, there's so many references in that article. It's all you need for now. I was going to give you others. I referenced the Levesque article that's in this, but I wanted to keep the science short and sweet. But you'll have this article, and if you open it up, even if you don't want to read it, go and take 5 minutes and look through the resources at the end, all the other articles that it references, because it's another meta-analysis that looked at many, many, many studies across the history of neurofeedback studies. And I find for most practitioners, those can be the most powerful studies, because if you look through it real quick, you'll be able to kind of see what has happened in all these different studies. And so even if you don't look for the effects, because this is also, this article is actually called The Long and Winding Road of Neurofeedback. So it shows different types of neurofeedback and looking at the differences between them versus other controls or other therapies. So it's got a lot to it, but that's why the references are great. The main thing that I wanted you to take away is that it talks about neurofeedback in 30 to 40 sessions, which is very comparable to what we talk about. It talks about decreasing the theta to beta ratio and increasing SMR as the approach in all these studies. And that is the approach that I've been advocating for a long time. What it shows is a large improvement in attention and impulsivity, medium improvement, which is still significant, it's still high, for hyperactivity. And it also shows that the brain actually changes in these selective attention networks within the brain as seen on fMRI. And that's a big enough takeaway for you in this webinar, is that there's a study that looked at lots of studies that shows that when we train theta down, and if beta needs to come up, and when we increase low beta or SMR, we can affect change for people in their behaviors and in their brains. Huge, so powerful. Okay, so it's all based on neuroplasticity, and I wanted you to have this little ditty as a takeaway. And of course, I tell people this: neuroplasticity can be our best friend if we are using it in the proper way. It can be our worst enemy if we're doing all the wrong stuff. Excuse me. So what I mean by that, and what this slide shows, is that if a person is doing neurofeedback, and if they also are reading, and you know how I feel about reading positive psychology types of books that put positive juju into the brain, if they are finding their meditation and their activity that they love to do at home, if they are closing their focus within that activity, and let's just say they like to build Legos, or if they like to play pool or anything like that, they're closing their focus, which will decrease their theta and increase their SMR or low beta, then they're using neuroplasticity. They're on the right side of neuroplasticity. They're using it well. If they don't do neurofeedback and a child goes to school, they're completely overwhelmed, they check out, their grades go down, now they get in trouble with the teacher, then the teacher calls home to mom, mom has a panic attack, now they're in trouble with mom, mom tells dad, dad's mad. That is a negative feedback loop. That is the wrong side of neuroplasticity, and it is shown to lock in those bad brain patterns. It can entrench, it uses the word entrench here. It can entrench that ADHD pattern, the anxiety pattern, create lots of bad patterns for people. Our job is urgent. That is the role neurofeedback plays. That is why I am here. We need to get as many people as possible doing neurofeedback for them, not for us. We're the servants. We're here to serve people using what I consider to be the most awesome technology out there. So know that you have power of neuroplasticity in your hands with neurofeedback. And now let's get that into the world and get people using it. And remember how neuroplasticity works. If a person works with you, they are going to begin to get better. And if they can embrace that, they will move forward. Embracing it means frequency, really, honestly. It means frequency. If they want to add other stuff, that can help. But if they embrace it and they move forward, you will change their life forever. And if not, if they leave and they don't get proper help, especially with neurofeedback, their brain pattern will get worse. That's why we need to get people in care with us. It's for them, not for us. So remember that when you have people in report of findings, because I know as a practitioner, especially all of us own our own offices, most of us do, we're in business for ourselves. Take the money out of the equation. I've told maybe you, but people time and time again, money is just energy. It is the energy that we must transact to be in each other's lives. It's an abundant universe. It'll come back to you. So take the money out of the equation when you're making your recommendations for people. Think about what that person needs to get better and how you will serve them. And then they will join you for care, and you will have a great time helping them, and they will get better. Okay, remember to go to my blog post at drtrishleigh.com. Of course, my other services are there, but there is a box to opt in for brain tips on both the Neurofeedback Expert page and the other main page. And every week I send out a blog post and has a video at the bottom. It has tips for patients, and at the bottom it has the science for practitioners, where it says for Neurofeedback Experts. So sign up so you can get that in your inbox and check it out each week. Doctors and practitioners love it. If you're not signed up, get signed up and tell any other neurofeedback practitioner that you know. That is my way of putting free content into the world for patients and for practitioners. And at the bottom, it has a video that's on my YouTube channel so that I can continue to provide the information for people. And you can send your patients to my YouTube channel. All they're going to learn is that they should come into your office for neurofeedback. Okay, I hope you enjoyed the webinar. I hope you got a lot out of it. And I look forward to presenting another one to you next month. Have an awesome month. Thanks.